Thank you all for coming. My name is Amanda Field.
I'm Andrea Reed.
And I'm Bailey Thompson. Today we'll be talking about anorexia. The eating disorder anorexia nervosa is the third most chronic illness among adolescents, making it the highest mortality rate in mental illnesses. 10% of people with this disorder die within 10 years of the disease. Anorexia is defined as when a person refuses to eat an adequate amount of food or can't maintain the minimum weight for a person's body mass index. People with anorexia are often hungry but starve themselves or don't eat the adequate caloric intake in a day. Throughout this presentation, we're going to be answering the question, should anorexia nervosa receive more attention within families and school? In order to discuss this question, we're going to go through our counterargument, effects on the body, effects of cognition, interview results, connection to mental health, connection to genetics, and resources and plan of action. For our counterargument, many people view anorexia as a lifestyle choice by thinking that the person can choose to live this way, also defined as an on and off switch to decide when they want to eat and when they don't want to eat. Dozens of sites that promote anorexia as a lifestyle choice rather than a mental disorder are flourishing on the internet. Health Daily says, websites that promote anorexia as a lifestyle choice refer to anorexia as anorexic beauty, emaciate me, and salvation through starvation. These websites include pictures glorifying women with their rib cages and spinal columns sticking out. They also provide tips on how to trick your family members and doctors into thinking you're not anorexic. For example, sticking rocks or heavy items into a hoodie while being weighed at the doctor's office. The community on these websites have chat forums where they can be encouraging to each other and offer support to continue with their eating disorder. For example, they can say things such as, people with anorexia just have more willpower and strength to be skinny than others. By doing this, they are providing validation to each other that anorexia is okay and just a lifestyle choice. When you're looking at it from this perspective, people do not see it as something uncontrollable like an addiction. Unfortunately, most people struggling with anorexia will never find a fondness to their body or feel that there's a point where they can stop because it is defined as an illness. The National Institute of Mental Illness describes anorexia and other eating disorders as a serious and often fatal illness that are associated with severe disturbances in people's eating behaviors and related thoughts and emotions. Because of this, it requires help mentally through therapy and family support to treat anorexia. Next, I'll be talking about the effects on the body that anorexia has. To start off, the most important one is the cardiovascular system. Northwestern medicine states, heart damage is the most common reason for hospitalization in people with this form of disordered eating. When consuming fewer calories, this causes your body to break down muscles for energy. The heart being the most critical muscle, your body ends up having no choice but to start breaking down your cardiovascular system, which includes your heart. Northwestern medicine also summarized this saying, this occurs because when your body is breaking down muscles for energy, the blood pressure of someone with anorexia begins to drop, and the more your blood pressure lowers, the bigger your chances at heart failure is. Another way of affecting your cardiovascular system through anorexia is intaking excessive amounts of water to replace food, or purging or vomiting the few times in which you eat. Both of these take away many of your electrolytes. Walden Behavioral Care states, a large percentage of dietary water comes from solid foods. When someone restricts their food intake, they become more susceptible to dehydration. Electrolytes like sodium, potassium, calcium, and chloride are essential for the body to function properly. Electrolytes play an essential role in helping the heartbeat and the heart muscles contract, which can lead to irregular heartbeats and high risk of heart failure. When you put all of these impacts on the cardiovascular system together, it can lead to reduced resting metabolic rate, and when this means the body must do all it can to conserve energy. This is our worst case scenario, and it will end up causing the body to shut down. All of these symptoms together will impact brain function and will incur in causing nausea and vomiting, confusion, headache, fatigue, irritability, muscle weakness or cramps, and seizures. Another part of the body that is impacted by anorexia is the immune system. About half of all anorexia people have low white blood cell counts, and about a third are anemic. Both of these conditions can lower the immune system's resistance to disease. This will end up causing the person to become sick a lot easier, since the body will not be able to attack the viruses as well. Also, with the immune system, the red blood cells that are being lost with anorexia cause many problems for the body and immune system. Red blood cells hold many nutrients that the body requires, for example, folic acid, vitamin B12, and iron. Walden Behavioral Care discusses the issue that arises when our body loses these due to anorexia by saying, a lack of these nutrients, commonly experienced by someone who is restricting food intake, often leads to anemia and inadequate oxygen transport throughout the body. It could also result in fatigue, weakness, pale skin, irregular heartbeat, shortness of breath, dizziness, chest pain, and/or headache. Following the cardiovascular system and immune system, our skeletal system is also impacted by anorexia. The most common start age of anorexia ranges during adolescence. This is when our bones are developing the most. Because of this, Diane Mickley, co-president of the National Eating Disorder Association and the founder and director of the Wilkins Center for Eating Disorders in Greenwich, Connecticut, states in Gina Shaw's article, there is a narrow window of time to create bone mass that will last a lifetime. You are supposed to be pouring in bone, but instead, with anorexia, you are losing it. Unfortunately, this is an irreversible impact, and although with the cardiovascular system and the immune system, you can improve over time while being involved in treatment, but this is not the case with our bones. You can never reverse the impact on our skeletal system. It is clear through our research that the body is drastically affected by anorexia. WebMD explains that no part of the body can escape the impact anorexia has, and our cardiovascular, immune, and skeletal system are clearly seeing the largest impact of anorexia. I will now hand it over to Andrea, who will talk about the effects on cognition.
Anorexia causes impaired social and personal cognition. Clinical data collected shows the effects anorexia has on the social cognition as opposed to those who have never struggled with the disease. Many patients who are currently battling the disease show signs of impaired cognition akin to traits on the autistic spectrum. Hamanatani research in 2016 showed that starvation alone, other cognition disorders aside, can cause significant cognitive impairment symptoms. When additional complications are present, the impairment worsens. Anorexia also deprives the brain of essential fatty acids, complex lipids of the brain needed to develop the areas of the prefrontal cortex. Because of the addiction cycle, this also changes the neural pathways of the brain, affecting hormones and the reward system, furthering the cycle. Anorexia patients also show other mental health disorders, such as anxiety and depression. Adolescents who suffer from this disorder have shown to struggle with peer perception and self-esteem. This begins the cycle in the disease and continues the destructive thoughts and behaviors. A study found that anorexic women had higher rates of anxiety than women without the disease. Research has also shown that findings also supported a significant relationship between theory of mind deficits, depression, and BMI scores. This is a crippling disease for adolescents because of their developing minds and bodies. As it progresses, many health issues occur as a result, and mortality rates become elevated, especially in girls ages 15 to 19. researchers confirm that the association of anorexia with a clinically significant increase in mortality rate. Death can occur because of malnutrition, but researchers also found that suicide was the leading cause of death. Because of the co-occurring diseases, depression especially, it leads to disorder in the thoughts that progress to suicidal thoughts. Anorexia disrupts healthy formation of cognition and body, requiring intense recovery. Prevention is essential in withstanding addiction. Now Amanda will present the findings of our interview.
We interviewed Hannah Wilhite, who has her master's in public health and is a licensed chemical defense counselor intern at the ranch of Dovetry. Wilhite explained that she believed social media affects anorexia by the media breeding comparison. Wilhite stated that there is an intense comparison and influx of viewing other people's lives is a fast way to feel inadequate. The issues Wilhite pointed out that affect anorexia besides the media is trauma, mental health, lack of coping skills, difficulty adjusting to life transitions, problems in school or at home, and an endless struggle with self-acceptance in periods of stress. As discussed throughout the research found, Wilhite is precisely right at every issue that could affect anorexia. Wilhite also discussed how families are impacted by anorexia, and if families are the cause of the disorder. She agreed that parents who frequently diet is a risk factor for the children to develop anorexia. Eating disorders also have a genetic component, which research studies have proved as well. Families with anorexia nervosa, adolescents, also impact mental health and body dissatisfaction. Wilhite described how families should model healthy behavior for one another and remain body neutral. For example, praising the children for who they are, rather than their body type and size. The main focus of the interview was towards the action schools could take to help the children who might be suffering or have symptoms. Wilhite believes that education on the topic is widely ignored. Wilhite discussed how the onset of eating disorders usually affects early adolescence. The children in schools could benefit from more knowledge and how puberty affects the body. The brain is not fully developed for the adolescent to identify mental health issues. Wilhite emphasized how the diet culture in our society has a significant influence on young children and discussing how puberty changes the body would benefit children greatly. Also, considering the principles of intuitive eating, which means only eating when you feel hungry and not when out of boredom and stress. This is even more prevalent as students continue their education. Anorexia nervosa also has a connection to mental health. As discussed, anorexia is a life-threatening illness that can cause cardiovascular disease and impaired social and personal cognition. To prevent a child from experiencing this disease, researchers have gathered information about how parents can educate their offspring. Researchers have found parents who have mental disorders present during a pregnancy jeopardize the child. The child will have a higher risk of an eating disorder during the ages 12 to 24. A parent who has a mental illness can affect his or her child in the future, even though other factors can develop eating disorders during the adolescent age. The percentage of anorexia nervosa doubled when parents had a mental illness themselves. Parents with anxiety, depression, bipolar disorder, and personality disorder are associated with increasing the eating disorder risk factor in their children. The reason children have a higher risk factor is because of the environmental factors of the family and genetic elements from the mother. Families will need to be aware of how their mental illnesses will affect their children. Finding a way to prevent occurrences of eating disorders would significantly impact families. There's also a genetic component. Mothers with mental health disorders, but mothers who have an eating disorder in the past or currently can affect their offspring genetically. There's a 7 to 12-fold increase in prevalence of anorexia in relatives of individuals with eating disorders than those who do not have an eating disorder. This means that mothers can pass this disorder down, and the offspring will have a higher chance of having an eating disorder themselves. There are many stressors a mother can have when she is pregnant, and the stress will be more significant for mothers with eating disorders. There was a research study that was conducted on mothers with eating disorders in a control group who had experienced no problems with eating disorders. The mothers who had eating disorders were found to feed their child on irregular schedules and feeding their child for comfort and as an act of love instead of when the child was hungry. Mothers with eating disorders have difficulty with feeding time in their children, and the study explained that mothers reported having tension when it was about to be mealtime. Mothers with eating disorders also reported feeling uncomfortable around eating around their children. These mothers would eventually show very high concern for their daughter's weight and shape as early as 3 years of age. A body of evidence suggests that maternal eating disorder increases the risk of parent difficulties and adverse development outcomes for the child. Studies have found that 32 to 72% of body dissatisfaction can be accounted by genetic factors. The genetic component of eating disorders, along with the pressure from mother's eating disorder history, can cause mental health issues and also an eating disorder. I'll now turn it over back to Andrea.
We've presented what the research has shown, how anorexia affects the body, and an interview with someone within the mental health field on how anorexia affects people. Through our research, we've come up with a 3-part plan of action that wants to look at research, education and awareness, and programs. Within the research, there are studies done over anorexia and its effects are minimal. The statistics show the significant adverse impacts, but the resources and treatment do not come close to combating it. One research study states, this study adds to the extremely limited literature on social cognition in anorexia and suggests further inquiry. Many other researchers include these suggestions in their research. One essential step to cause change would be to conduct more significant quantities of research and extensive studies. Another step for our plan of action is education and awareness. In regards to education, we believe that it will further inquiry and research and is essential in continuing to teach the effects of anorexia, especially regarding the development of adolescents. Policymakers and legislation are crucial to furthering the support of this research and providing opportunities for treatment. This will allow for greater outreach of education, support to suffering families, and funding to further research. For awareness, it will also begin to destigmatize anorexia within our society. As Ms. Wilhite had stated, society does not have accurate views of the diseases of anorexia or any other eating disorders. This leads to inaccurate assumptions and stigmas. Researchers found that those who struggle with anorexia are seen as in control of their disease, as if they could quickly stop it, or are personally responsible for it. Social media has become inescapable within our society and has been found to cause significant influences on adolescents. Studies have shown that media portrayals of individuals with anorexia influence society and are the primary source of information regarding anorexia, yet they minimize the severity of these conditions. Accurate portrayal and education into the realistic effects of anorexia would help to teach society, especially adolescents, susceptible to social media, and destigmatize the disease. Researchers highlight the urgent need for public education regarding the severity and public health significance of anorexia. Such efforts could ultimately reduce stigma and improve rates of treatment seeking for individuals with these chronic conditions. The last part of our plan of action are programs. We looked into 2 different programs that have proven to be effective on the collegiate level and have shown improvement for those who are in junior high and high school. The first program is the Body Project by the National Eating Disorders Association. They state that the Body Project is a group-based intervention that provides a forum for women and girls to confront unrealistic beauty ideals and engages them in the development of healthy body image through verbal, written, and behavioral exercises. The Body Project was developed by researchers at Stanford University, the University of Texas at Austin, and Oregon Research Institute, and has been delivered to over 1 million young women around the world. The conceptual basis for the Body Project is that if girls and young women voluntarily argue against a societal appearance ideal, this will result in a reduced subscription to this ideal and to the consequent decreases in eating disorder risk factors and eating disordered behaviors. The Emily program is another program we researched, and it's based on the belief that individuals are unique and they intuitively seek meaning, value, and creativity in life. Effective treatment requires an awareness of the genetic, biological, psychological, social, and cultural impacts on each person. They believe that treatment with yourself in mind can help you get better. They also provide residential treatment, day treatment, and outpatient treatment programs. Anorexia nervosa is a chronic illness that does significant damage to our bodies. The cardiovascular system, the immune system, the bones, our social and personal cognition are all impaired because of this disease. It also causes co-occurring disorders such as anxiety and depression. It can be argued that it is a lifestyle and easy to stop. However, it is a chronic disease that requires rehabilitation to overcome it. Genetics also plays a major factor in those who suffer with this disease. Our interview of Hannah Wilhite explained to us the need of awareness in public schools. This can help in prevention and intervention for the students to reach out. A solution was applied at Texas Tech University called the Body Project, and we plan to implement this in junior high and high schools. The Emily Project is another one of those projects, and it has been shown to be effective. Family and schools need to take in more awareness of this issue and speak up. A mandatory weighing and body mass index screening in schools, help with health-based programs, and affordable treatment programs would all aid in this. It would help adolescents be more aware of their bodies and help fight this disease that impacts their mental health and body dissatisfaction. Anorexia is a disease that impacts the body, cognition, and relationships. Treatment and recovery are necessary steps in overcoming this disorder. This is our brochure that we created that summarizes our main points on the effects of anorexia. This is a tool that can be passed out through junior high and high schools to help spread that awareness. Thank you for your time in considering our plan of action, and we thank you for your attention.